In South West London, what we've been doing to develop primary care networks is really starting off by talking with GPs and with practices to understand what their challenges are.
This is an opportunity to actually work together to ensure that we're sustainable, patients are getting the right care.
There's been a lot of engagement and sharing of knowledge and resources and cross-fertilisation of best practice.
So it improves the service to the patient, consistency to the patient, and performance across the whole borough.
So one of the really important things about networks is the opportunity for general practices to work with other agencies in a more integrated way, and we want to try and support that because that could really result in better care for patients.
We are probably about 6 months into our network. Everybody is actually working together quite well. It's actually improved the relationship between the surgeries in the area.
And there's also the benefit of improved resilience.
It's a lot about working collaboratively together, building in that resilience and supporting each other as practices within a network.
The bottom-up approach that we've taken has meant that we have been able to develop a model for primary care networks and collaboration, primary care at scale in South West London.
So far, we've done a good job in establishing those networks and getting them up and running and going.
The networks are going to allow practices, I think, to buy in much more resource. At the moment, there's very few practices who have taken up bringing in pharmacists and physios and paramedics to help with staff shortages.
Collaboration really could offer some answers to the sustainability question in the face of rising workload and the workforce gaps.
We know that in general practice, one of the biggest challenges has been, workforce recruitment, and there's an opportunity there for practices to work together to resolve some of those issues.
But I think the networks are really going to improve practice resilience because it will be much easier for them to call on their network now. These are the people that when things go wrong or when they need help, they'll know that they can call their member practices and ask for help.
Each network or each locality has its own dedicated resources to support patients with complex needs. They are referring those patients out into the MDT, and that saves them time to actually look at, the more acute cases that comes through the door.
The money that will be coming down into networks is coming through in a way that will really help networks to be able to support the work that they're doing and resource it and help them to think on a much more population level rather than just thinking about how their individual practices work. And I think this is very important for general practice sustainability, for integration and for better care for patients.
We want to develop our care teams around the patient, and they will be integrated care teams sitting around the patient, looking at what the patient needs are.
They're going to be seen much quicker, and they can be seen by people who will actually probably help them better.
We'll be introducing social prescribers into general practice as well as pharmacists, and then later on we'll be recruiting paramedics and physicians associates and physios, and patients will all be able to benefit from those staff and their skill sets.
The patients, if they need mental health support, they could actually see our social prescriber that could actually offer them more support than perhaps a GP could at that particular time.
We'll also be trying to integrate multidisciplinary team working into the way that we're working in networks.
I think the patients would be very pleased to have a variety of clinicians looking after them.
We are speaking and engaging with our patients and making sure that the Federation and the primary care networks are actually engaging and co-designing services with their patients.
GP federations have been really involved in the early development of primary care networks, and we know that clinical engagement, the clinical leadership as part of all of this has been key in getting practices on board.
It's going to really work hand in hand, so the federation would be like an umbrella support for all the various PCNs.
We are the people who we can pick up the phone, we know the partners, we know the practice managers, we can have these kinds of conversations with them, they trust us, they know we're neutral, we're there to help, we're there to support.
And we think that there may be some value and some economies of scale in GP federations working to coordinate some of the activity of the networks if that's what the networks want.
Where the federation plays in really beautifully is when we are supporting in terms of the governance arrangements for these networks, in terms of employment. The federation is there to support them.
Even though they'll be in a network, there's still resources that they're going to need to call on, and that's where we come in, again, providing resources to the practices but also to the networks.
The Federation has an infrastructure to support those networks, and where there is a specific need around a certain problem area, the Federation will source some sort of resource or support for the practices and the networks to find that solution really to whatever their problems are.
In these early days, it's really important that GP practices and the clinical leadership in practices gets the support that they need to start to do some of this development work. And our GP federations could have a really important role in that.
As a federation and us members of the federation, we're here to support them to make primary care networks a success.
Primary care networks are just a real game changer, actually. I think it presents a fantastic opportunity for practices to think differently about their future, about how they can create their future so that they're really thriving.
We think the creation of networks, provided it's done well and resourced well, has the potential to really benefit practices and therefore benefiting patients.
It's been an interesting journey for us. The outcomes of that have been that we have got well-defined local networks in Merton working very well together and actually enthused about what they're doing.
I feel quite chuffed, and it's just growing and it's getting more positive and positive every day, really.
It's all about improving local healthcare outcomes ultimately, and that's what the aim is.
But this is a really good new opportunity for us to work out what our future is.